that women have about having this important test.
Hi there, thanks. Dr. Dan Heron here from Mercy Imaging Center. Welcome, thank you so much. And we're going to throw out a lot of statistics. Don't get overwhelmed here. But the main thing that you just had a story about a couple of women that came in for mammograms, right?
Right, I was just sharing with you last week. I had a woman who was getting a mammogram every year. She came in, we found a little tiny cancer about the size of an almond, and she will be cured. Same week, a different woman not getting mammograms. She came in, her cancer is about the size of a lime. I'm really hopeful she'll be cured, but it's not quite as guaranteed as the first woman. And both women were like most women with breast cancer. Neither woman had a family history of breast cancer. 80% of women who get breast cancer have no family history of breast cancer.
Repeat that, because I think a lot of people think that because, oh, it runs in your family, chances are higher for you. But what did you say?
Right, exactly. 80% of women who are diagnosed in the United States this year have no family history of breast cancer. So basically, being a woman and getting older are your risk factors for breast cancer. That's why we think everybody should be evaluated.
Let's talk about some of these statistics here. 1 in 8 will develop invasive breast cancer in their lifetime. 1 in 8?
Yeah, that's correct. Now, it's different on how old you are when we do that diagnosis, but it is a common breast cancer. I'm sure most of your audience knows somebody with breast cancer, a friend, family member, coworker.
Mammograms identifies about 84% of women who have breast cancer.
Correct.
That's a very high statistic.
Yeah, we find most cancers. It works better in some women over other women, but in the majority of women we can find their cancer when it's curable and early treatable with less surgery, less chemotherapy, less intervention.
Risk of harm of radiation, you said it was just like very, very low.
Yeah, there is a little bit of radiation from the mammogram, but I try to tell women it's like if you walk around in Sacramento, you get about 1 mammogram a year. So I'm just trying to put it in perspective of how much radiation there is.
Breast cancer screening options include other breast cancer screening options. You said ultrasound.
Yeah, we have mammography. We have newer types of mammography. We use ultrasound to find breast cancer. We use magnetic resonance imaging. So we have a lot of tools to find these early curable cancers.
Because a lot of people feel that the mammogram is going to hurt. And here's some of the things that, like you said, 27% say the most fear-inducing appointment is even worse than blood draws and dental visits.
Right. I think a lot of women don't get a mammogram. They're afraid of the results. They're afraid it's going to hurt. They don't think they're going to get breast cancer. They're not at risk. I realize all these things are real things. Most women who've had a mammogram no longer fear it. They realize it's not as torture, as painful as they think it will be. So I think most people who actually do it are relieved, and I think we need to do a better job as physicians on decreasing those anxieties, giving results promptly, and treating people, you know, trying to limit how many interventions and procedures we do.
On your study, a lot of women say they don't plan on getting a mammogram. What age should women get mammograms, and how often after that?
The average woman with no family history, no risk factors should start at age 40 and get a mammogram every year. There are some women that are higher risk because of family and other factors that might need to start earlier. And there are some women at really high risk that may need even other tests earlier than 40 besides a mammogram like an MRI, for example. But every woman at 40 should start, you know, going to her mammogram.
If you have, you'd like to make an appointment, of course you have to have a doctor's referral and also insurance clearing this. Here's a number here for you, Mercy Imaging Center, 916-434-7600. Dr. Dan Heron, thank you so much.
Thank you
Say hi to Dr. Jacobson for me.
I will.
Back over to you.
Thank you.
Thanks, Tina. Thanks.